Hi, my name is Teresa Horab. I'm a registered nurse and Iasis microcurrent neurofeedback provider and trainer, and I'm very excited to share something that I'm very passionate about called Iasis microcurrent neurofeedback. So let me say that biofeedback's been around for over 50 years. Neurofeedback has been around since the 1990s. Iasis microcurrent neurofeedback is like the evolution of. Although it's under the same umbrella as neurofeedback, it's actually called LIPDIS, low intensity pulse using transcranial electric stimulation. Iasis has been found to be very helpful in many different conditions such as ADD, ADHD, OCD, anxiety, depression, post-traumatic stress, post-traumatic brain injury, addiction, strokes, fibromyalgia, insomnia, and much more. It's also used widely for peak performance, athletically, executively, and academically. You may be asking yourself, how could one treatment help with so many different things? Well, that's because we're treating the brain, and the brain is the operating system of the whole body. It's kind of like the operating system of your cell phone. And so when we treat the brain, we're essentially getting to the root of the problem. So when we experience trauma could be physical, car accident, sports injury, could be emotional, loss of a loved one, separation of parents, could be chemical, something we're putting in our body, knowingly or unknowingly. It could be environmental, something we're being exposed to. Well, the brain is a protective organ. So when we're experiencing this, our brain goes into something called fight or flight. It's like the gas pedal gets stuck. That causes a buildup of metabolic waste called alpha and beta amyloid protein. A neurochemical flooding occurs causing axonal damage, and this causes an interruption in the electrical flow. So we have trillions of neurons in our brain, and they're the communicators. So imagine pinching the cord that goes from an electrical outlet to a light bulb. If I inhibit the flow of electric, the bulb's gonna maybe flicker. If I pinch it real hard, I could potentially turn it completely off. So picture the brain kind of flickering, or in the case of a stroke, where it's completely off. So if the flow of electric is good, the bulb is going to be bright. Picture the bulb being the brain. Iasis is going to calm down that fight or flight, decreasing homocysteine, cortisol, adrenaline, and norepinephrine, calming down the central nervous system. At the same time, it's going to increase GABA, serotonin, endorphins, and dopamine, allowing auto-neuroregulation. Iasis doesn't heal the brain heals itself. So the treatment is very simple. The patient doesn't have to do anything, nor do they feel anything. They simply come in and relax. The treatment itself only takes about 15 to 20 minutes. So we're not shooting electric into the brain, we're actually causing a transcranial stimulation. And that's why I'm able to treat little children, autistic children, patients with dementia. It's actually safer than holding a cell phone to your head. As a nurse, I love it because it's safe. It's non-invasive. There's no medication. It's very effective. There's no side effects, there's just well effects. And it's much faster than traditional neurofeedback. In fact, 85% of people will report that they feel just calmer, lighter, happier. Often they tell me that they feel more focused and more present. A lot report that they sleep better and have vivid dreams. And people around them don't get on their nerves as much. So what happens is you come in, you get a treatment, you feel a little better for 24 to 72 hours later, and then you kind of go back down towards your baseline. You come in again and again. So the more treatments you have, the better you'll feel and the more sustainability you'll feel. Usually around 6 to 9 treatments, your whole week starts feeling better. We often recommend that you come in twice a week for a couple weeks, then once a week for a couple weeks, and then every other week for a couple weeks. We kind of wean you down as your sustainability gets a little stronger. So it's not always necessary for you to come back after you've completed maybe 12 to 20 treatments, but I will tell you, it's also great for peak performance, and a lot of people just love the way it makes them feel from a maintenance standpoint. You see, if I'm able to bring you from here to here, if you stop, you don't necessarily go back down to here, but you may do this, and people really like this. so maintenance is always an option as well. One thing I see Iasis doing is instilling hope. And when hope is there and you have a choice, you want to grab onto it. So congratulations on taking the first steps to move yourself in a healthier direction. We're glad you're here.